Butter or margarine? For decades, this question has divided kitchens, doctors, and nutrition experts. Some people say butter is natural, so it must be healthier. Others say margarine is better for the heart, but only if it's made the right way. So what does modern medical research actually show? In this video, we are not giving medical advice and not promoting any brand. We are simply comparing butter and margarine using findings from peer-reviewed studies and major health institutions. By the end, you'll understand difference between butter and margarine. Which is more saturated fat? Which is the better choice for your heart? Butter versus margarine. Which is healthier? Alternatives to butter and margarine. What is butter? Butter is a traditional dairy product. It is made by churning cream until the fat separates from the liquid. Butter is mostly milk fat, with small amounts of water and milk solids. From a nutritional perspective, butter is high in saturated fat. It contains cholesterol. It has very little polyunsaturated fat. Butter has been eaten for centuries, but modern nutrition science focuses not only on tradition, but on long-term health outcomes. What is margarine? Margarine was originally developed as an alternative to butter. It is made primarily from vegetable oils, such as sunflower oil, rapeseed, canola oil, soybean oil. Older margarines contained partially hydrogenated oils, which created trans fats, a major health concern. However, after trans fat bans in many countries, modern margarines are now very different products. According to the University of Minnesota School of Public Health, today's soft margarines are nutritionally improved and no longer contain industrial trans fats in many regions. Butter versus margarine. Which has more saturated fat? This is one of the most important differences. Butter. Around 50 to 55% saturated fat. Margarine. Soft or tub margarines made from vegetable oils are much lower in saturated fat, often higher in unsaturated fats, which are linked to better heart outcomes. Research published in the American Journal of Clinical Nutrition, 2023, shows that replacing saturated fat with unsaturated fat is associated with improved cholesterol profiles and lower cardiovascular risk markers. This does not mean fat is bad, but the type of fat matters, which has more trans fat. This is where margarine's reputation suffered in the past. Old margarines contained industrial trans fats. Trans fats raise LDL, bad cholesterol. They also lower HDL, good cholesterol, strongly linked to heart disease. However, according to the British Heart Foundation, the University of Minnesota, and recent nutrition reviews, most modern margarines no longer contain industrial trans fats due to regulatory bans. Butter contains small natural trans fats, but these are not considered as harmful as industrial trans fats, though butter is still high in saturated fat. Salt content in butter versus margarines. Salt is another important factor. Butter. Salted butter can contain moderate sodium. Unsalted butter contains very little sodium. Margarine. Salt levels vary widely. Some margarines contain more sodium than butter. Many brands offer low salt or no salt options. From a heart health perspective, experts recommend checking labels, especially for people managing blood pressure. Which is the better choice for your heart? This is where long-term research matters most. According to analyses published in the American Journal of Clinical Nutrition, reviews discussed by the British Heart Foundation, key findings include diets higher in unsaturated fats are associated with lower cardiovascular risk. Replacing butter with soft margarine or vegetable oils can improve LDL cholesterol. Butter consumption is consistently associated with higher saturated fat intake, which can raise LDL cholesterol. Importantly, these findings apply to modern, non-hydrogenated margarines, not older trans fat-containing versions. Butter versus margarine. Which is healthier? Most heart health organizations now agree on a balanced position. If choosing margarine, prefer soft or liquid margarines made from vegetable oils, low in saturated fat, no partially hydrogenated oils. If using butter, use small amounts. Treat it as an occasional food, not a staple. The British Heart Foundation states that unsaturated fat sources are generally better for heart health than saturated fat-rich options. Alternatives to butter and margarine. Many experts now suggest alternatives such as olive oil, canola, rapeseed oil, avocado spreads, nut-based spreads. These options are naturally high in unsaturated fats and have strong evidence supporting heart health. Final thoughts. The margarine versus butter debate is no longer simple. Modern research shows butter is high in saturated fat. Modern margarines are nutritionally improved. Fat quality matters more than fat quantity. Unsaturated fats are generally better for heart health. As always, overall diet quality matters more than any single food.